Fear and ambivalence. These two emotions capture the tension we have faced throughout the pandemic. Hi, I'm Dan O'Brien, Director of the Boston Area Research Initiative at Northeastern University. In collaboration with our colleagues at UMass Boston's Center for Survey Research and the Boston Public Health Commission, we conducted a unique survey of Bostonians that allows us to compare experiences, attitudes, and behaviors during the COVID-19 pandemic across communities, by neighborhood, by race, by income. Our results from this survey strongly confirm this tension between fear and ambivalence. On the one hand, we see broad consensus among our respondents that COVID is dangerous, masks are important, and that we should avoid high-risk activities like attending gatherings and visiting in other people's homes. But there were those who differed from this consensus, and in great enough numbers to have critical implications for their communities. Interestingly, how they differed varied by race and income, which I'll elaborate on, suggesting that there will be multiple strategies to supporting each community as the surge of cases continues to rise. These results were summarized in a report we released today, Monday, November 30th, 2020, the second in a series of results from the survey. Let's look at a few graphs that summarize the main takeaways. First, let's start with the good news. We asked people how much of the time they wore a mask when going in public in April and the summer. And as of April, over 70% of people said they wore a mask all of the time. And in summer, this number rose to 85%. And so this is highly promising in terms of being safe. However, if we look at the number of high-risk activities per week, things like attending gatherings, visiting in other people's homes, in April, nearly 70% of people said they took part in none of these activities, and this plummets to just over 30% during the summer. And we see people engaging in as many as 5 to 7 or 8 or more activities in a week, and non-trivial numbers of people. So now, if we start thinking about this in terms of geographic distribution, right, we look at this map here of where people said that the guidelines for social distancing were important for people in their community to follow. And we see in some neighborhoods, especially in majority-minority neighborhoods like Dorchester, Roxbury, Mattapan, and East Boston, we see high endorsement of guideline importance. But if we look at the east coast of the city, we see a number of neighborhoods, so northern Dorchester, South Boston, the Seaport District, that feel less strongly about this. And when we compare that map to the map of where people engaged in high-risk behaviors during the summer, we see some important similarities here. The areas with the highest amount of people who were taking part in high-risk behaviors in the summer were the Seaport District, the North End, North Dorchester, South Boston, which really matches with this previous map of where guidelines were seen as important. It also matches with reports over the course of the summer of where people were seen as potentially breaking social distancing guidelines at beaches, restaurants, so on and so forth. Now, if we turn to where people said that others wore masks, so this was something we did in the survey. We didn't just ask if you wore a mask, we asked if your neighbors wore masks. And it turns out the maps were somewhat different, as everyone said that they wore a mask, but only 40% of people said that their neighbors were always wearing masks. And we see some interesting patterns here. Again, South Boston, the Seaport District, North End stand out as places where people said not all people were wearing masks. But then there are some other parts of the city like Mattapan or Roxbury where we see people saying that they always wore masks, but that their neighbors not as much. And interestingly, neighborhoods like Jamaica Plain, West Roxbury, Roslindale over on the west and southwest of the city fell somewhere in between. Now, the last thing I want to point out, which was a really interesting finding to us, is where people believed that asymptomatic spread was possible. That is, this confounding aspect of the disease, that someone who is quote-unquote infected but not showing any symptoms can spread the disease to other people. And we found that 85% of our respondents understood this fact. But that still leaves 15% of respondents who didn't, and that's a non-trivial portion of the population. And what we find is they are not evenly distributed across the city. They're concentrated in majority minority, low income, or disadvantaged neighborhoods. As you can see in this graph, the highest proportion of people believing that asymptomatic spread was not a thing was in Lower Roxbury and Central Dorchester, and to a lesser extent in Mattapan, Hyde Park, and East Boston. Now, if we look really quickly at that distribution across income levels, we see an almost perfectly linear or curvilinear relationship where people who were making less than $30,000 a year, over a quarter believed that asymptomatic spread was not necessarily a thing. And this diminishes by the top of the income bracket. In fact, it diminishes by people making $75,000 a year or more to a trivial proportion of about 5%. Now, these insights have crucial practical implications as infections steadily rise across the state. Most importantly, they expose ways in which each community might be vulnerable to spread as cases surge again. On the one end of the economic spectrum, we see some ambivalence toward guidelines themselves. This is more common in more affluent, majority white neighborhoods. On the other end of the economic spectrum, we see more misunderstandings about how the virus can be spread. This suggests different types of messaging campaigns to support and educate each of these communities in the coming months. Please stay tuned as we have many more insights from the survey to come. Next week, we will be releasing a third report on the economic impacts of the pandemic. We'll see you then.